your airway is the core or the foundation of how you're going to be healthy.
Donny, thank you so much for joining me on The Bottom Line.
Thank you, Seven, for inviting me to join you today. It's such a privilege and an honor.
Well, thank you. Well, I don't feel that way because we've gotten to know each other a little bit, and you have an amazing journey of business and things that you've done. And recently, you're about to launch a book, so I can't wait to dive into that. And yeah, so
Nice.
for those that don't know who you are, if they don't follow Instagram, but I just wanted to just get an understanding on sort of how you introduce yourself, how do you tell people who you are, what you've done, and get our listeners a better understanding of who Donny is.
Sure. Well, I am a myofunctional dentist. Basically, it's quite a niche part of dentistry. Myofunctional means we look at the functions and the postures of the muscles of the mouth and face. And there aren't that many dentists who focus on myofunctional dentistry in Australia and even around the world. So we're in a pretty privileged position. Some of us were myofunctional dentists, and we do teach, and we practice myofunctional dentistry as a focus. And even though I am actually a general dentist, I don't actually practice general dentistry. Like if you ask me to do a filling, Sevan, it's going to be really crappy, okay?
That's hard. I haven't been eating too many lollies, so I'm feeling I have gum issues more than anything else. So my teeth are pretty good. So for those that actually don't know what myofunctional dentistry means, it's obviously quite niche and it's not as widely practiced
Yes.
globally from what you're saying.
Mm-hmm.
For those that are unfamiliar with how you treat patients as a myofunctional dentist, take us through that sort of, what does your clinic look like? So I know it's quite unique. You don't even have a dentist chair. So take us through that.
That's true. That's true. We don't even have a dentist chair. A lot of our patients are mainly pediatric patients, like probably more than 90% of the patients are children under 12, because these children are the one that still have quite a lot of growth potential. And so we would like to get their functions as optimal as possible while they're still growing, because what we believe is form follows functions. When you're an old guy like me, right? Nothing's really growing anymore. In fact, I'm probably shrinking. And, you can still correct the function, but structurally, nothing's really going to change too much. There would be a little bit of changes, but, that's why we're targeting a lot of the children, because they still have that natural growth potential. So my practices, I have 2 clinics in Melbourne. Yes, they don't look like a normal dental practice at all. Everything is very much purposely designed to accommodate, the children who come through the door. And a lot of these children who require our help, they have quite a lot of dysfunctions, basically. And when I say dysfunction, it's not just about how the muscles of the mouth and face are working for them, but there is quite a lot of deep connection between the muscles and also the way the whole body works, because there are millions of variables in our bodies. Like there's so many different systems that are supposed to be working together. So when we see a patient with an orofacial dysfunction, which means that the muscles of the mouth and face are not working as well as they should be, that could affect a number of things. It could affect their airway, which would affect the breathing, sleep. It could affect their nervous system as well, which means that they're more in sympathetic overdrive, which means that they're more in that fight or flight mode, affecting their sleep and so on. And there are a lot of these kids who are waking up in the morning from poor sleep, that they're overtired, they're exhausted, and they become hyperactive and actually gets misdiagnosed as having ADHD.
Wow.
So I think the statistics, like from memory here, is about 50% of ADHD kids are actually misdiagnosed, where the real reason is actually because they have poor breathing and poor sleep instead.
Wow.
Yeah, so it's quite interesting, and that's why we want to try to get to the root cause of it when we do myofunctional dentistry, instead of just treating the symptoms and, trying to get these kids basically to avoid medications and things like that.
How do those kids find their way into your medical practice? Because I guess that, the parents aren't, dentists or doctors, so they don't really they just have maybe bad teeth, or they're not sleeping well. They either go to a GP or maybe their routine dentist checkup. How do they find their way into your clinic, and how should parents actually be looking out for signs? For all our parents that are listening that have got young kids,
Sure.
take us through sort of the diagnosis from a parent perspective on how we should look at sort of bringing people like you into the fold.
Sure. I mean, there are quite a lot of number of symptoms that you can look out for in your children that may give you a clue whether they are functioning well or not, right? But a lot of our patients, we get them through our collaborative network of practitioners. Because, as I mentioned before, there are so many different systems in the body. We do have to work with other practitioners because, as dentists, my scope is really just, above the neck, right?
Yeah.
I can't venture below the neck, really. But this head, this mouth is sitting on the head, and this head is sitting on your whole body.
Yeah.
So we do have to collaborate with other practitioners. So we get a lot of patients from pediatrician, from integrative GP, from ear, nose, and throat specialist, from chiropractors, osteopaths, physiotherapists, speech pathologists, lactation consultants, and so on. So it is more of word of mouth, and obviously other parents talk to other parents as well, from a lot of the parents group, mothers group, and so on, that would recommend our practice. But yeah, there are quite a number of signs and symptoms that a lot of parents can look at for in their children when it would probably trigger a little bit of an alarm bell in terms of whether they should seek some help or not, right? For example, if they have really poor sleep, snoring, teeth grinding, waking up multiple times at night, they are still bedwetting at an age where they shouldn't be, like maybe over 4 years old, right? These are all could be signs and symptoms of actually poor breathing and poor oxygenation of their organs. Yeah.
So the poor breathing is obviously how your mouth and teeth and all that function. Obviously, being a dentist now, myofunctional dentistry. How do you fix these cures? So how do you take us through an example just to get us the juices flowing on a child? My oldest daughter did teeth grinding. She doesn't grind her teeth as much anymore.
Sure.
I knew you back then and knew of this. I would have gone, well, okay, this is what we got to do.
Yeah.
Take us through some examples of poor breathing, and then exercises and things you do, because I love your social media and you show some examples and stuff. Take us through in your words,
Sure.
an example, so we can get a bit of a flow on how that all works.
Yeah. So first of all, I think I need to define to our listeners the differences between healthy breathing and not healthy breathing. I call them functional and non-functional breathing, right? Or dysfunctional breathing. A lot of people tend to get a little bit caught up in the terms mouth breathing or nose breathing, but it's actually functional or dysfunctional breathing, because you could be a mouth breather and you are still breathing dysfunctionally, right? So functional breathing actually means, yes, your mouth should be closed, your tongue should be up, you are breathing through your nose slowly and gently, and you're using your diaphragm, which is your breathing muscles, to pump all the air in and out into your lungs. And you're actually getting proper balance of oxygenation of the gases to your organs. And when I say gases as well, it's not just oxygen. We're talking about oxygen, carbon dioxide, and nitric oxide, which are the three most important gases for breathing, right? So that is what functional breathing is. So when you are dysfunctionally breathing, it could mean that, yes, your mouth is open, your tongue is low, you are snoring, you are noisy, you are over breathing, which means that your shoulders and your neck and your head are probably all going up and down, and you have like a forward head and neck posture, which means that you're trying to open up your airway because your body's probably feeling like you're not getting enough oxygen. So all these things are signs of dysfunctional breathing. Yeah. And when we see a patient doing so, we've got to really investigate and work out what are the root causes that could be causing this particular person to end up in this state of breathing, right? And there's a number of different causes, and I'm now tracing it back to even before the child was conceived, basically.
Oh,
yeah.
wow. Is it that genetics? Is that what you mean?
Well, it's partly genetics, but I would call that epigenetics. So
Okay.
epigenetics means that the way the genes are being expressed from one generation to the next
Oh, okay.
has been influenced or altered by environment, right?
Wow. Yeah.
So yeah. So we've had like parents, for example. I'll give you an example of this family that I saw a few months ago, and they brought two kids with them, an older one and a younger one, right? The older one was probably about 6, and the younger one was around 3 years old, I think. And they actually were more concerned about the older one because he wasn't sleeping well, bedwetting, snoring, teeth grinding, and so on, but not much concern about the 3-year-old. And if you think about it, these two kids are growing up in the same family, same parents, but the younger one not snoring, not teeth grinding, sleeping well through the night, eating well, and so on, right? Growing well, no behavioral issues. Whereas the older one was always tired, so he would have mood swings and behavioral issues and so on. And so my question to the parents was, what was the difference in the pregnancy,
Oh.
right? And there was a difference, actually. So the mother did not initially click when I first asked that question. But then she thought about it for about a minute and thought, oh my goodness, when I was pregnant with the older one, I was undergoing so much stress with her work. Yeah. And then with the second one, it was the best time when of her workplace. Yeah. And so with the older one, because she was undergoing so much stress, she was like even fainting and things like that.
So it was quite extreme, yeah.
Correct. And so that would affect the way that that child was growing inside her. Imagine that she was actually needing to supply nutrients, not just for herself, but for the child growing inside her. And then if she is under stress and if she is under a lot of these external toxins, exposing her, then of course the child growing inside her would be affected as well.
Wow. Take us through the breathing part. So it's such a sleep, like I'm talking about just what's common at the moment, a lot of podcasts, a lot of content around you need to sleep better. I'm wearing a Whoop at the moment.
Yeah.
Tracks my sleep. Take us through the habits that we need to build as young people so that as adults, we have good sleep, we have good breathing. I mean, you've obviously got to do this in your clinic where you're teaching kids that are dysfunctional breathing.
Yes.
Just if I've got two daughters at home, 13 and 9.
Yeah.
What can I do as a parent where I'm not seeing any issues? With either of my kids, I'm not seeing any sleep issues or tiredness or even snoring or anything like that. But just educating our children around breathing with your nose, all of those things. Let's take us through that sort of coaching.
Well, first of all, it's interesting that you said you haven't noticed any issues. And it's probably because a lot of parents don't sleep with their kids anymore at that age.
That's true.
So you probably don't know that they're actually having issues, right?
Okay.
So a lot of the times when I ask my patients, do you snore, do you grind your teeth? Yes, the child wouldn't know themselves because they would be asleep, and when their sleep gets interrupted, it doesn't mean that they're fully awake, right?
Correct.
Basically there are different cycles of sleep, and they may not go through the whole cycle where the body is actually jolting them in a way to wake up because they're not getting enough oxygen because their breathing is dysfunctional, right? So in terms of trying to get really good quality of sleep, you've got to really make sure that, first of all, the sleep hygiene is great. Like, for example, no screens within 2 hours of bedtime, right? All this blue light from the screens can really muck up your circadian rhythm, which is your sleep rhythm. And that is one thing that is a big issue right now with the the young generation. That's right. And it is really reactivating that sympathetic nervous system, right? And also these teenagers now, they drink even lots of coffee and stuff like that. You shouldn't really
sugary drinks.
Yeah, sugary drinks. All these things like sugar and certain food groups can be very inflammatory as well, right? And food, what you put into your body, if it's inflammatory, if it's pro-inflammatory, it is going to have a higher risk of causing congestion in your airway and in your breathing apparatus, basically. So if your airway is inflamed and congested, that means that your breathing is going to get affected as well. And that's where we see, the volume, airway volume, or the size of the airway, it's too narrow, which means that they cannot breathe properly, which means that they need to over breathe, and then and that would affect their sleep too.
Yeah.
So sleep hygiene, the type of food that you have, right? Things that should be less inflammatory, that would help the airway health as well, and making sure that your nervous system is pretty much regulated. So a lot of the times when kids have dysregulated nervous system, as I said, they're in that sympathetic overdrive, which means they're in fight or flight mode all the time. There could be some reasons for that. I mean, breathing could be causing the sympathetic overdrive, but it could also work the other way around. So in this myofunctional world, Seven, it's like a vicious cycle. Once something goes wrong, it affects another, and it affects whatever that we thought was causing it in the first place, right? So it's not an easy thing to do, or I suppose it's not an easy resolution in terms of every patient, right? And that's why I believe that, when we treat a patient, we do need the time to be able to uncover and peel off all the layers of the onion, because there's so many layers of it. And once you pick a dysfunction, another one comes up, and it could be related. So, and that's also why we need to collaborate with other practitioners as well.
What can parents do today? One thing that they can do, you mentioned that they don't these days sleep with their kids, and some of them are old enough now that shouldn't be sleeping with their kids. What can they do? Is it a video recorder in their bedroom? Is it actually slinking into the bedroom and sleeping on the floor? What can we do? So for my 9 and 12-year-old, 13-year-old, where I truly think they're okay. How do I know that that is real, and what can I do? 1 or 2 things that can validate that.
I do always ask the parents to somehow videotape their kids sleeping, right? Maybe even through like a monitoring system or some sort. Obviously, you don't want to interrupt their sleep while you're doing that as well. But also, videotaping doesn't mean just videotape them for like 30 seconds, right? Maybe videotape them for a good 10, 15 minutes and then see whether there's any changes. Because if you do it only for 30 seconds, it could be the part where they're actually sleeping very well, but you're not seeing the bigger picture. So videotaping is actually a very, very good way of finding out whether your kids are sleeping well or not.
Do you value products like the Whoop and the Apple Watch and the sleep measurements in that can give you insights? Do you think that's a value?
There are some apps that are quite valuable. For example, like Snore Lab, that can actually indicate whether that person who's using the app is actually snoring or not. One thing is if you use it on yourself, for example, Snore Lab, it could be recording your wife's, right? So just got to be careful with that.
No, you got to go into isolation. Let's take us through the adults. So I sometimes we have stressful moments in our business, and sometimes people come in and I have to help them out. And a lot of the time I'll be just like, let's take a pause. And take some deep breathing and exercises around just calming and reducing our heart rate and all that. So I'm big on, being able to sort of take yourself away from stressful moments and de-stress through breathing exercises. For those that may have had issues growing up and not know, what can adults do? Do they come and see a myofunctional dentist, or do they go, no, what I'm going to do is go to the gym in the way, as an analogy on doing activities or exercises that's going to make me a better breather, better sleeper, actions that may, I can take that whether I snore or not can actually improve those things. What can adults do in today's environment that can help their performance as well?
It's actually all of them and more.
Wow.
Because there's not just one solution to the issue, because there's so many factors that's contributing to breathing and sleep issues. And also the type of breathing and sleep issues that each person has as well, that can make a difference too. But obviously, yes, the food that you eat, how active you are in terms of movement, and how are you doing your breathing as well. One thing though that I feel is a bit of a game changer is looking at the nervous system of that patient, right? Because if you are in constant fight or flight, you would never be able to regulate yourself, right? So there's a few tricks that we do for our patients in terms of trying to get them into the parasympathetic mode, which is more your rest or digest, right? And the parasympathetic nervous system is mainly supplied by what's called the vagus nerve, which is cranial nerve number 10, right? And it's the longest nerve in the body. It comes from a Latin word called the wanderer, right?
Wow.
So there are certain exercises that you can do to activate the vagus nerve. And if the vagus nerve is activated, which means that it has a higher or better tone, that means you are more in the rest and digest mode. So first of all is doing calm, shallow breathing, like what we can call the box breathing, which is counting to 4, right? So inhaling, counting to 4, exhaling, counting to 4. Yeah, right?
Okay.
And make sure that you keep breathing in and out through your nose. Yeah, and just keep your lips closed and keep your tongue up.
Yeah.
Right? Another good thing to activate the vagal tone is to do a bit of humming. Right?
Okay.
You can just hum to your favorite song or something like that, just slowly and gently. And that can activate the vagal tone as well. Another good thing that you can do anywhere is gargling. Right? So if you gargle, you're actually activating the vagal tone that's behind your throat. And if you gargle by looking up to the ceiling, keep your mouth open and stick your tongue out, which is not easy to do. Just make sure that you don't spill water everywhere. That actually activates it even further. Yeah. So box breathing, humming, gargling are simple things that anyone can do to activate their vagal tone, their vagus nerve.
Yeah. Well, that's what I'm doing straight after I brush my teeth. It's funny, my daughter took up she's just started year 7 last year or this year, and she chose voice as her musical instrument.
Yeah.
My wife really wanted a violin, but we went with singing, and she does some of that stuff. So they actually, she does this thing where we're in the car and I'm taking her to school, to voice class, and she'll be like, she'll do little things. It's about getting her mouth and her tone ready. And I feel like it's sort of, do singers and people that practice singing where they have to use their diaphragm, are they more likely to have a better, myofunctional, not dysfunctional breathing and better things in their above the chest and below the chest? So
in my experience, yes. My daughter went through voice and singing and all that as well, and she was practicing like what your daughter's doing now. And they tend to have better tone in terms of their tongue and their soft palate, right? And better, I suppose, better integrity of their airway muscles as well, right? However, I have seen quite a few singers whose their singing coaches have asked them to come and see me.
Oh, wow.
Because they have restrictions in their mouth. And so when they're doing all these exercises, voice exercises, they're unable to do them as well as they should, right? And when I talk about restrictions, I'm talking about like a tongue tie or a lip tie or a cheek tie, which would affect the way the muscles of the mouth and face function and posture. So a tongue tie means the string under your tongue is too short and too thick, that it restricts the mobility and the elevation of your tongue. So there's been quite a few singers that's come and see me, and in which we have to help them to loosen this tongue tie, basically, so that their tongue can work better. Yeah.
I love that. It's such an interesting. All I'm thinking about is it's like a car service. It's like next time not that I'm gonna have another child, but I feel like, and maybe even my 9-year-old, even Laurie, the older one, is it best practice to just as routine, like we go and see the GP as part of when children are born, they check up on, are they healthy? Are they count, how many words are they saying at 6 months and all that kind of stuff? Shouldn't the government implement this kind of stuff and introduce your services around the myofunctional component of the body in terms of dentistry and the face? Is that something you're pushing for? Because I don't know if it's in in those places anymore. And I think
Well,
it'll be so valuable.
I think it will be too. However, this is you're touching on more controversial topic here now, because from my experience, right? I mean, I've been doing myofunctional dentistry since 2001, so this is actually my 25th year of doing it.
Congratulations.
Oh, thank you. And I have never really met any doctors or pediatrician that's working in the normal like hospital or government or sector or public sector and so on, that would implement looking at the nervous system and at how these kids are breathing and functioning, right? I have got a couple of pediatricians who are looking into that, who are collaborating within my network, which is great. But the majority, I would say 99.9% of the medical practitioners are not looking deep into it. And even a lot of dentists are not looking into this. I mean, if I can with two hands, I can count the number of myofunctional dentists that's in Australia.
Wow.
Yeah, I only need two hands.
That is
So it's very, very little. I do suggest though, when any parents out there listening who are about to have a child, take them to see either a pediatric osteopath or a pediatric chiropractor maybe, just to have a checkup, right? Because there's so many things in the birth experience and in the first 1 year of life that's very, very important in terms of how they're going to grow and develop. It's going to really determine a lot in terms of how your child is going to progress and how they're going to thrive. Yeah.
Let's go back to business.
Okay.
Now,
Yeah.
you are a dentist. You ran a successful dental clinic. Take me through, and I'm sure most dentists do well for themselves, and take us through this journey of closing your dental practice and taking this leap into a new practice where you, even to this day, you can only count them on two hands.
Yeah.
Take us through, not anxiety, but how did you make that decision? How did you feel? What business strategic plans or execution tips did you go through to pivot from dentistry to myofunctional dentistry? And yeah, you're still, and it's been 25 years, and I know you have grand plans, which we'll go into, but take us through that, dentistry to now this.
Sure.
And what was that journey like for you?
Yeah, well, when I graduated from dental school, which was 1998, right? Just like any dental students, I wanted to be a prosthodontist. And prosthodontist is like, you specialize in crowns and veneers and dental implants. It's like a wow, But then I soon realized after going through my first employment that I didn't want to be a prosthodontist, because I felt like a lot of general dentistry and a lot of what people consider as normal dentistry is more about fixing the issue. And I would like to know what were the root causes of these issues in the first place? How could these patients that I was seeing got into this state, right? And I was lucky enough that the second job that I had after graduation, the practice was very, very progressive, and they actually pushed me towards what's called functional dentistry route. And that's where I started to learn about functions. And it became a big journey, because basically, they opened the can of worms for me, and then I now in this rabbit hole that never ends, right? And there's more and more deeper and deeper connections that I'm finding out in these 25 years or so. So I've opened my first general dental practice in 2004 with a business partner, and I opened my second one in 2012, and I opened my third one in 2017. And the third one was the one where it was purely just myofunctional dentistry with no general dentistry at all. Then I sold my first one to my business partner, and my second one, I transformed that into a myofunctional dentistry practice as well. So since, I think it's been 5 to 6 years now that I haven't really done general dentistry. And it's just been full on myofunctional dentistry. And I believe that I was ready to focus on that because I had time to really implement it and work at what's a good system and a good protocol. To me, in this type of business, healthcare, right? If you have the right intention, you'll be able to make it work, you see? Because I feel that there's too many healthcare businesses where they just look at profits, and to me, it's healthcare. You are a healthcare practitioner, and what I would like is for my patients to get healthier, right? So if we have the right intention, then everything else will work out. Yes, money is important to be able to sustain the business, but if your intention is correct, the money will actually come. Yeah. And that's why everything needs time, right? It's not about speed, to me, in terms of building the type of business that I am in. It's about the direction, right? Having clear direction and having good systems and protocols in which will move the direction, correctly down the right path. And that's also why, I have 4 dentists and 4 oral health therapists now in the team as well, and 3 lactation consultants. Yes, it's, there's a few practitioners, but it took me a long time to get them as well, because I have to get the right people. Yeah, the right people who's got the right intention, who's got the right mindset, who's got the right philosophy, not someone who's just wanting to, make money, basically. Yeah.
I think you're in the right space because, well, I've had Stephen Liu, who is the founder of Everlab, on the podcast, and recently Harry Weisinger, who is My Performance Doctor, and both those businesses really practice in that preventative space.
Yeah.
Getting to know, your health early on, not when you're sick. How can you be healthier?
Yes.
Doing blood tests and understanding where things can go wrong, where you need to then make improvements.
Yeah.
Again, dentistry kind of didn't fall into those conversations at all. They weren't dentists to begin with.
Yeah.
But if you think about dentistry, there is that maintenance component. You got to go to a dentist to get your teeth cleaned and check up and so on. But then when you put braces on or fillings, it's preventative. It's not. It's reactive in its nature.
Yeah, that's right.
So I feel like, how does the dentistry, sector in terms of medical switch to being preventative in a real aggressive way? And I feel like myofunctional dentistry is that. You are the Everlab, you are the My Performance Doctor of the dentistry world. So I think you're on a winner, in the sense that I feel like humans and people in globally now want to be proactive in their health, proactive in their business, and not be reactive. And there's so much going on in that space. So I think massive growth is on the horizon, and just in this space, I hope that it goes well. But you actually own this space because you teach around the world globally. So are you a professor then? Are you creating a university? Take us through, how are we going to go from 2 hands to hundreds, and how are you going to be? You are a bit of a thought leader. We'll go to the book in a sec, but take us through your speaking, your educating journey, and you are the space of, myofunctional dentistry in Australia.
Well, my team calls me the Professor, Seva, but I do like them to call me God instead anyway, and that's a different story. But no, I'm not a professor. I am a general dentist, and there is really no formal qualification of myofunctional dentistry, unfortunately. There's not even any governing body that really recognizes this. There are associations around the world that recognize orofacial myology, we call it, right, which is the study of the muscles of the mouth and face. But there's no formal governing body. Yeah. So I think it's still a bit of a journey for us myofunctional practitioners, because it's something that a lot of people are not really recognizing. Yeah, it's actually been around for over 100 years, would you believe? And there's like millions of research behind it, right? But the problem is this: a lot of people say to us that, there's no solid research behind myofunctional dentistry, because a lot of the papers or the articles that we see are more about case studies, right? It's because it's a little bit, plays on your morals. When you see someone who are not breathing, not sleeping properly, would you do a research where you wouldn't treat this kid and see what happens, and you would treat another one and then compare, right?
Yeah.
So it's a little bit hard to do a
A
randomized, double-blinded, triple-blinded study if you've got that moral and ethics in you, right?
Yeah.
So that's what's difficult about it. But we are seeing millions and millions of case studies from practitioners around the world, actually, that have helped a lot of these people. But one thing is, a lot of parents expect things to just happen and to resolve very quickly. But as I said before, everything needs time. So it's not about the speed; it's about the direction. Yeah.
Let's talk about the book. What inspired you to write Behind the Smile, and why did you feel these stories needed to be shared?
Well, first of all, I'm gonna present you with the book. Right? This
Thank
is
you.
for you. Yeah,
I love it.
It's actually soft launching in a couple of days' time. So you're one of the first to.
I love it.
Seva. Now, it's been a while in the making, really. So many of my colleagues and friends have encouraged me to write the book. And in June this year, actually, so about 6 months ago, I'm in the middle of taking a break from teaching at the moment. And so in June was my last teaching gig, which was in Perth. And my flight back home got delayed by 4.5 hours. And I thought, what am I supposed to do? So I got my laptop out and started writing. And then I actually finished the book in 8 weeks.
No way. It takes
You just couldn't
so speed.
I just couldn't stop. So yeah,
Amazing.
a bit of an irony, me talking. Don't worry about speed, but I was pretty quick about writing the.
That is super speed.
That is very quick. Yeah, and the inspiration behind it is because I've seen too many families coming to me saying that, how come no one's ever told me this before? I've seen 10 different doctors or 15 different dentists, and no one told me about what the functional issues that my child has, right? And it's actually very, very common. Like, I meet these families almost on a daily basis when I practice. So I would like this book to, I suppose, send a message to the public out there. It's a book not for other health practitioners, but other health practitioners hopefully can use it for their patients as well.
Yeah.
And I've written it in a fiction way, even though it is a non-fiction book, but it's not a textbook, right? It's following a journey of one of my patients and how that patient got from where he was to where he is now. So it's more of a storybook that I hope will resonate with a lot of people out there.
Amazing. And it's formally launched in February, but you can buy it on Amazon. I think it's coming out.
It's coming out tomorrow afternoon, actually. Yeah,
which is the 12th of December. We're recording on the 11th.
Yes, that's
right. So for those that are listening, get on Amazon. It will be there. As just a general advice, again, back to sort of adults in their day-to-day life.
Yeah.
What are the one thing I can do today when I walk out the door to just be better at everything to do with the mouth, the teeth, the tongue, the breathing, the sleeping? What's the one thing you highly recommend?
I think you need to practice functional breathing. Basically, the breathing, your airway is the core or the foundation of how you're going to be healthy, right? The second thing I think is look at the food that you eat. Yeah. So make sure that you stay away from inflammatory food like sugar, or some people are pretty sensitive to dairy and gluten and so on. But these are the foundation of your overall holistic health. Yeah.
And before we close, your journey, what's the horizon look like for Donny and the business and the book? We're going into 2026. What are some of the things that you hope to achieve in the coming 12 months?
Well, next year, I'm actually learning more about what I do and taking it to a different level. I'm actually learning about cranial osteopathy and how that is going to relate to myofunctional dentistry, because the jaws are part of the bones of the head. And so I need to know what is going on with the head when I'm treating the jaws here, and what's going on with the rest of the body that's supporting this head on top. Yeah. So it's a bit more of studying throughout next year. And hopefully from that study, I'll be able to produce an even better protocol in terms of myofunctional dentistry. And I'm hoping that that will happen in the next 1 year. And once I get really solid protocols, really solid system, then I'm hoping that there'll be more people replicating this and implementing the systems around Australia and maybe internationally as well, if I'm lucky. And it's just a matter of trying to help as many people out there, because the modern world that we live in, there's so much environmental toxins out there, not just the screens, but the pollution and so on. And this may sound pretty cliche, but I do believe the future generations is the ones that we got to look after, because they're the ones who's going to carry on, yeah. And I may not be here by the time it happens, but hopefully it will happen, and I would know that I've played a really small part in making it happen.
Yeah, I speak to so many business owners around the podcast and the business here at Alexander Spencer, and a lot of them, do lots of different things in their business. And as they get to the tail end, the word legacy starts to come through in terms of what they say as they're nearing the end of their business life cycle or business journey. I feel like legacy is probably more front of mind. I think you've pretty much created this in Australia. You've taught it. You've probably could walk away from it knowing you've left something behind that's already started.
Yeah.
But I reckon legacy would be a big part of your words that you're probably thinking about. The book, I'm so excited for you to have launched the book. But not only that, if you can make this happen and get awareness and more practitioners that hopefully, understand the benefits of myofunctional dentistry and get more referrals out there, we get these young kids actually diagnosed properly. The stat around ADHD really, scares me around, because these kids then get medicated.
Yes, correct.
And yes, it might help them, but there's generally, side effects of these medications. So I hope that the listeners today, have learned something about what you do and how you do it, and hopefully we're medicating less, preventing more.
Correct.
And you have definitely shaping some of the things that's going to happen in the future, so that legacy piece for you is going to be pretty cool. I want to say thank you for taking your time out of your day to join me on The Bottom Line. Your expertise has been amazing. I'm going to do the box breathing and the gargle. So tongue up.
Yeah, you can hum all day long.
All day long. So thank you, Donny, for joining me.
Thank you so much, Devin. Thanks for having me.